Lauren. How are you? I'm Dr. Michelle. Nice to meet you.
I'm doing great. Thank you. Thank you for having me.
You're welcome. What brings you in today for an audiology consult?
So I just never really thought to get my hearing tested before, and just like the older I get and with the line of work that I do, I've noticed that maybe I should get tested. I'm starting to notice that I'm not hearing as well as I maybe used to. So I just wanted to come in and see what you could do for me.
What type of work are you in?
I'm a flight attendant, so I work on airplanes, and it's just the engines are really noisy all the time, and I just noticed that it's harder for me to hear customers sometimes, so I just wanted to get it checked out.
So the first thing I'll do, let me take a quick look in your ears to make sure that there's no debris or obstruction, and you can stay right where you are. Take a quick peek. This one. Perfectly clear. Now the next thing we'll do is the hearing test. So what I'm going to do is I will put the headphones on your ears. You're going to listen for a variety of different sounds, and what I want you to do is when you hear something, just give me a little thumbs up.
Okay.
That way I know that you hear it, and what I'm looking for is the softest sounds that you can hear for all of the different sounds that make up our language.
Okay.
So your job is to be a good listener. So I'm going to start on the right side. And when you think you hear something, just give me a thumbs up so that I know that you hear it. Alrighty, now we'll do the same thing on the other side. Perfect.
Great.
We're testing the sounds of speech. Some sounds are low frequency, some sounds are high frequency. The low frequency sounds they consist of our vowels. And the mid to high frequency range is mostly consonants. Your hearing in the low and mid frequencies is perfectly normal. But as we get out to the high frequencies, it drops off to a mild, moderate hearing loss, which means I'm turning it up between 25 and 60 decibels. Normal hearing is when you can hear all sounds below 20 decibels. What that would cause you is sometimes, if you're on the airplane, which the airplanes are noisy, and a passenger's asking you a question, you might have to lean in. You might have to strain a little bit to understand what they're saying to you. This is an example of a receiver in the ear style hearing aid, and it matches our clothing. But with this style, this is rechargeable, this is waterproof, and this is also built with the most current technology that it will give you those things like I discussed. It will give you good hearing almost everywhere you go. It'll give you remote control capability, and it will give you Bluetooth capability. And the way that this one sits, this tiny dome goes inside the ear canal. The device goes behind the ear. And it's a perfect accessory to my red dress, but it's nearly invisible.
Yeah, you really can't see it.
With cost, first of all, we would look at insurance benefits because a lot of insurances are now offering some sort of coverage for hearing devices. If benefits aren't available, hearing devices can be pricey, but what's most important is your quality of life and better hearing. So Lauren, do you have any questions today? I know that we've gone over a lot of information and that this is going to be a journey that we're going to go on together. Anything that I have not answered?
No, I think you answered everything. Thank you so much.
Wonderful. I look forward to seeing you again for your hearing aid fitting. Thanks again, and we will see you soon.
Thank you so much.
You're welcome.
I'm so glad I came in to get my hearing tested. Dr. Michelle was so great. She was so informative. There was so much information, and I'm really excited to go on this journey to get this hearing aid. I really think it will help improve the quality of my life.